when I learned about Grant Halliburton Foundation, it's just been awesome. Working with the Grant Halliburton Foundation, working with the staff. Like you said, Blanca is a really, really important partner of mine, of ours, of the Garland Police Department. And the resources you guys provide, like especially the mental health navigation line, it's just been, it's an awesome, awesome tool. So every year I get assigned over 600 just emergency detention cases. So an emergency detention case is where a family is called 911 because one of their loved ones is in some kind of crisis and they don't know what else to do. They call 911. And officers come out and the patient ends up getting transported to a behavioral health hospital for crisis stabilization. When I get assigned those cases over, like this year, we're already at 615 for the year. I do intelligence-based follow-up and research of those cases. And the Grant Halliburton Foundation's Mental Health Navigation Line is literally always one of my top 3 resources to give these families. And if you have anything to do with this foundation, be it that you donate to it or you donate time, it's time and money well spent, because the feedback that I get from the residents that I serve, from some of our staff that has used the Grant Halliburton Foundation's Mental Health Navigation Line, the feedback I get is just really top notch. Like it's, if you've ever watched that video that Grant Halliburton Foundation has about the navigation line, that's the kind of feedback I get. I get feedback from the family members, from the loved ones that, it was so helpful. It's helped them figure out other resources besides just 911. It's really, really a valuable thing. I could talk for a long time being a cheerleader of the Mental Health Navigation Line and Grant Halliburton Foundation. It's really, really been helpful. Kevin said something about how I founded that Law Enforcement Mental Health Alliance of North Texas. And I just wanted to touch on that real quick. So when I started working after 16 and a half years in patrol, responding to dispatch calls, when I put in for and was selected for the first ever mental health liaison at the Garland Police Department, I knew right away that I wanted to partner with various resources that are high quality, like the Grant Halliburton Foundation, that I needed them to be part of our team so we can do the most good. And I also wanted to figure out what other police departments, what were they doing? I didn't want to just have on blinders, and I didn't want to just stay in my lane. I wanted to see what else was going on and see what we could adapt and maybe what we could do better. And so I started trying to figure out, where is law enforcement in North Texas? Where are they meeting to exchange these ideas? About a year and a half ago. And I was finding out that we're not. Like, there were some other auxiliary meetings with law enforcement in the behavioral health hospitals, but somehow law enforcement wasn't meeting together to exchange ideas on all things that are brain health related. So I just had a list of about 20 other officers I know that are mental health liaisons or something similar at other North Texas departments. And within a year and a half, I'm up to over 35 North Texas agencies are part of LIMA. And the last meeting before COVID knocked us out temporarily, I had over 80 some participants. And Grant Halliburton is part of LIMA. So the bulk of the members are other people that are mental health liaisons in law enforcement agencies, sheriff's departments. We even have a FBI special agent that comes, municipal police departments. But I also invite our partners to attend. So Grant Halliburton attends our LIMA meetings, and it's just become a really good, like I call it, a think tank. It's where instead of we come up with some good ideas with Grant Halliburton Foundation, we as in Garland PD, we don't just keep those to ourselves. When we go to the LIMA meeting, or now we're doing things on Zoom or just email, we share that information to all of North Texas. So it's been a really, really good information sharing and just a think tank, a real good think tank. Part of what I wanted to talk to you guys about today is I know with this audience that it's really, really challenging to work and we try and do the best we can and help our family members when they have a brain health concern. And it's not much different than any other medical condition that's internal, that you can't really see. It makes it a lot more challenging compared to like if there's a broken bone or something. And so when I was starting to think about the 16 and a half years on the street and the work I've been doing the last 19 months or so as the mental health liaison, I started trying to think about like with Halliburton Foundation and NAMI North Texas, where I actually just got elected the president of NAMI North Texas. So now I'm actually the president there, and we're going to be doing some good things, I think, and especially in partnership with places like Halliburton Foundation. But I'm working there. I was started trying to figure out how can we start helping some of the residents that I serve, and how they can be better equipped to speak with their loved one when their loved one is in crisis, especially when the crisis is something that's particularly upsetting to them. I think there's another mic. The subject line says you agree to use Amazon Pay for payments to I don't think that's me.
Everybody, make sure you're muted, please.
But so I started trying to look at like what can we work on where we can help family members, dads, be better prepared when their loved one, when their child is in some kind of having a crisis, or they have some kind of brain health concern. And so you heard that I'm on the S.W.A.T team as a hostage negotiator. I'm about 10 years in on that. So I've had a lot of hundreds and hundreds, probably thousands of hours of training in a really high level listening and high level empathetic listening skills. And then I went to the Suicide and Crisis Center, where you heard that I'm one of their telephone crisis counselors. And I went to their 42-hour school, and I started getting some different ideas, and I learned some different things about how to really listen and connect with the person in crisis at a high level. And then I've had some other training with 22KILL and their QPR, and just continuing negotiator training. And when I was interacting with families, and I'm going on calls, and their loved ones are in crisis, I started noticing that these skills that I learned to speak with someone that was in a crisis started really working good with other individuals. Well, they weren't committing an offense. There wasn't a crime. It wasn't like they took someone hostage or anything of that nature. But I noticed that some of these same skills were working really well for me to connect with that person, for me to really establish a communicating relationship with them that let them know that what they have to say and what they're feeling like is really important and really matters. So today I just wanted to talk to you about some of those things that I've learned that's helped me speak to someone at a meaningful level and really show empathy and establish a rapport and actually gain some influence to get a behavioral change. So in crisis negotiations, that's called a behavioral change stairway. You use active listening skills, and we'll kind of talk about what those are. And then you're empathetic. You've established a rapport with the person that's in crisis. That helps get some influence, and then we get behavioral change. And like the behavioral change could be something really simple as they're no longer as upset. They're no longer as in such an active crisis, all the way down to the behavioral change could be they're now willing to accept resources, or they're willing to accept going to see a therapist or a treatment plan or something of that nature. So one of the first things that is simple but challenging at the same time, especially when you're a dad, you have your occupation is something where you're making decisions and fixing things and executing a plan. Sometimes this part can be challenging, but one of the most important things when you're communicating with your child, or you're communicating with a young person, or just anybody that's in crisis, is you want to listen. Like that is the biggest, most important thing. If I leave everyone today, all the attendees today, is that you want to listen. You want to listen. People in crisis, people that are upset, they want to be heard. People in crisis want to be heard. When I'm on the crisis line and I answer the phone, and like just recently, a 15-year-old female called, and she was really, really upset, and the phone call lasted about 35 minutes. And the main thing that I offered the caller was listening. I let ventilation happen and listen. It's really easy to start getting bogged down, and it is for myself, in thinking that I want to solve what this is. But that's really not what's most effective when you're trying to communicate at a really high level. So really want to listen. That's really important. Other things seem kind of, to me, they almost seem like common sense. But sometimes when someone's in crisis and we have this fix it, solve it mentality, we might miss out on something else that's really helpful. And that's just using a warm, kind voice. I mean, that kind of sounds silly, but I know for myself, when I'm going somewhere and I'm thinking I'm going to fix this, be it if I'm working with someone to fix one of my race cars, or I'm at work and I'm on some call that has a criminal element to it, and we're going to fix that. I might have more of an authoritative voice. So I might just have more of like, this is how it's going to be. When someone's in crisis, when we're trying to work with someone that has a brain health concern, be it your child or just anybody else you come in contact with or you care about, you want to remember to use a warm, kind voice. So listening is really important. Then you want to just use a warm, kind voice. And this can also seem kind of like common sense, but it's easy to forget about when you're in a moment with someone that's in a crisis or they're really upset, is you want to make sure that you remember to use the person's name. So even if it's your child, a lot of times we find ourselves not using that person's name so much, or your significant other. You might not use their name so much. You might have something else you replaced it with, or you just communicate so much with that person that we kind of forget to use their names. Using the person's name has a really calming influence. It really personalizes the situation. So we want to really remember that. We want to listen at a really high level. We want to use a kind voice. And we want to make sure we exchange names. We want to personalize the situation. Probably second to listening, the next thing I'm going to talk about that's really, really effective, has a really positive effect on the interaction, is we want to, so we've already kind of taken out that we're not going to try and solve this problem. We really want to just listen, let the person ventilate, and we're not going to get bogged down in thinking our mind is, all the mental energy we have is being taken up with, oh, I got to come up with a solution for this. So instead of using all of our mental energy thinking of a solution, and then we're no longer really being able to listen to the person who's upset or who's in crisis, we want to focus on paraphrasing or mirroring back what's being said, what the person's saying. It is what takes all the pressure off of communicating with someone who is upset. Maybe they're enraged. Maybe they feel helpless. Maybe they're really hopeless or sorrowful. I mean, it's really, really difficult to listen to that while I'm thinking about a solution. So instead of doing that, I'm going to make it really easy on myself. And when the person is speaking, when my loved one is speaking, I'm going to then paraphrase or mirror back what I heard. So if I'm hearing my child talk about how it looks like her boyfriend has, dumping her because he's not responding to her text messages. He's not responding on anything on the social media anymore. And she's telling me more details and really upset. Instead of me stopping to listen in the first 10 seconds or less, because I'm thinking of a solution, I would just say back, hey, Sherry, I hear what you're saying. Your boyfriend is not responding to your phone calls or text messages. He's not responding on the normal social media channels, but you see that he's doing other activity on those channels. And, I can see that's really upsetting to you. And that's how anybody would feel in that situation. A real key component of that is like saying that's how anybody would feel. When your child, when someone's in crisis that you come in contact with, that's like something that can be really, really meaningful to that person, is to hear that that's how anyone feels in that situation. It's not because they're crazy. It's not because they're inept at dealing with life. It's not because they're somehow defective or they just need to move on to something else. It's literally helps them really feel reassured that that's how anybody would feel in that situation. So paraphrase and mirroring is really, really, it's like listening is number one. But then the paraphrase and mirroring is right there. If you want to be successful, if you want to make a meaningful connection to someone that you care about, to your child, when they're in a crisis or when they're really upset or feeling helpless or really sorrowful or hopeless, that part, listening and paraphrasing back, is really, really important. It's a key to being successful and really making a tight bond, a tight connection with that person that's in crisis or just in general, just feeling sad or depressed or anything of that nature. One of the next skills that I've learned and really seemed to be very, very effective, especially with hundreds and hundreds of hours on the suicide and crisis line, is when you're speaking to someone and you're not going to get bogged down trying to come up with a solution, because the solution may be fairly complex. I mean, you might need a medical professional to assist. You might need a therapist. You might need some kind of non-traditional treatment, and it might be a program, not much different than another medical condition that can afflict the human experience. It might be a program that's going to take a while. It might not just be I say something and it's fixed. It might actually take some time. It could take some months, just depending on what the medical condition is. But you really want to be focused on not using any kind of judgmental words. When you are really interested in connecting with your child and you want to have that deeper, more meaningful relationship, you want to keep the words that you choose to say, because you're going to spend most of your time just listening and paraphrasing. That's what makes it so much easier for you to do those two skills. But when you do speak, you don't want to have any kind of judgment in your language. You don't want to say anything like, hey, what you're talking about is not a good idea, or you're going to get in a lot of trouble, or what do you think your mom would think, or what's grandma going to think, or what's your aunt going to think. You don't want to use any judgment like that. Any kind of judgment like that is going to create a barrier between your connectivity with your child, with your loved one, and then it's going to actually become a negative to actually coming up with a de-escalation, coming up with the person being in a much more of a, maybe they won't be as upset, they won't be as distressed anymore. But if you use judgmental words, that's just going to ramp things back up. That's just going to be a barrier. In negotiations, we have like labels and titles. We kind of have our own language. And if we use judgmental words, we know that's going to be a trigger. That's going to trigger the person that's in crisis to ramp back up. And we want to do the opposite. That was when I talked earlier about the behavioral change stairway. When you get some influence, you're changing the person from being in a crisis to coming down. That's that behavioral change we want. We want them to come back down to more of what their normal is. So we want to focus on non-judgmental words. This is something else that's very unnatural for most human beings that I've come in contact with. And it was unnatural for myself because I was trained differently by family. I was trained differently by media. I was trained differently, by what I saw on TV or movies. But when we are speaking to someone, one of our children, someone that's in crisis that we come in contact with, we want to be very focused on not shifting the focus to us. So when you're speaking with someone that's not in crisis, and maybe they're not particularly depressed, or they haven't been diagnosed with anything that's like deals with resulting in being in a crisis, then you can kind of shift the focus to yourself. So like if I was talking to Kevin about maybe he told me that he has some low back pain. And I could say, hey, 10 years ago, I did too, and I did X, Y, and Z. So I'm shifting the focus to myself. I did X, Y, and Z, ended up getting surgery by Dr. Barnett at Baylor, and now I'm so much better. I can shift the focus to myself when I'm talking to someone that's not in crisis. But if my loved one, if my child is in a crisis, I'm not going to want to shift the focus to myself because that's not helpful to get part of the behavioral change stairway. That's not helpful to try and influence the person to be back to more of their normal or their calm state. So I do not want to shift the focus to myself. So like say when I was talking to Sherry and she's telling me about what's happening to her, that it looks like her boyfriend's dumping her and she's very, very upset. And she's telling me how she sees him communicating on other social media platforms, just not with her. I don't want to change the focus to myself and say something like, well, at least you don't need surgery on your low back, or at least you weren't just in a car wreck and you'll have broken bones or whatever. I don't want to shift the focus. That's when I'm wanting to paraphrase and reassure my child that that's how anybody would feel. I mean, imagine the difference of what that sounds like, especially to a young person, but it really is effective with adults that I've worked with that are in a crisis, or they're feeling really upset or fearful or alarmed, or they're terrified or they're miserable, or any of those kind of emotions. When I don't shift the focus to myself and I'm paraphrasing and I'm listening to what they're saying and I'm kind of mirroring it back, and then I tell them, man, that's how anybody would feel. Imagine the difference between if I would have told Sherry, hey, Sherry, that's not a real problem. I mean, I know people that have so much worse than you. I mean, you should be happy right now. Imagine the difference. And when you're trying to communicate with your child and you want it to be really meaningful and show that you really care about this person, imagine the difference between hearing that's how anybody would feel that's in that situation, or hearing, that's not really a real problem. I mean, we have this nice house and nice cars. You have all these toys. Imagine the difference in effectively connecting with somebody that, especially your child that you care about so much. So never shift the focus to yourself. Try and really make that important. That the focus stays on the person that's in crisis. Like we talked about before, people that are in crisis, people that are really upset or feeling overwhelmed or depressed, especially during these pandemic times, and especially for young people where their lives have just been turned on their head. They're now like what we're doing. They're just talking over this platform, pretty isolated, pretty alienating feeling. People in crisis, they just want to be heard. When we shift the focus to ourselves, they're no longer being heard because we're talking about us now and about how some other people have it worse, or we have it worse than they do. Something else that's really, really important is kind of like a step process to communicating with somebody that's in crisis, like your child, is we really want to help remove the stigma of being crazy. When I heard Kevin talk about that they've learned real quick that dads weren't interested in talking about their troubles, I mean, that is completely mirrors my profession. And of course, there's so many dads in this profession, but you can't get police officers that I'm around in North Texas or elsewhere, colleagues I have in New York or California. You can't get officers coming to talk about their problems. There's a lot of tough guys here. There's a lot of warrior mindset. So if you're just going to try and have them come and talk about their problems, I mean, you can forget about it. Like the stigma is really, really strong. So we want to all be part as dads that are, really leaders in this area, because you're part of Halliburton Foundation and you've got 10 other things you could do right now, but you're here listening to this because you want to be a leader in this field. We want to be part of the agents of change. We want to help remove the stigma. So we definitely don't want to ever talk to one of our loved ones or anyone else we come in contact with that's in a crisis about anything about being crazy. We want to remove that stigma. We want to normalize brain health conditions. Is just another medical condition that can afflict the human experience. Like it's really, we want to normalize it. It's no different if you have a heart problem, you have a brain problem, you have a knee problem, you have a low back problem, they're just all medical conditions. I think we could even be as agents of change when we're trying to remove the stigma of being crazy especially when you're speaking to someone that's in crisis. We might want to start thinking about, we might not even call it mental health anymore. I mean, like, health is health. I've really been hearing that again and again from some of the professionals that I work with. But we want to be part of agents of change. When we're speaking to someone in crisis, we want to help remove the stigma of being crazy. And one of the things I learned that's pretty easy to remember that I would just say to the person is, the brain is just another organ in your body. It's just another organ in the human body. It receives the same blood that other organs in the human body receive. And sometimes the human body and the organs in it can benefit from medical treatment. I mean, literally your brain, and when I'm talking to some people in crisis over the years, 18 and a half years going on talking to people that are in various levels of crisis, sometimes that's really like an aha moment for people when they hear the person they're talking to saying that the brain is just another organ in the body. It might be the most complex one. And it's not surprising when it doesn't always process everything and work at the level that we would like it to all the time. It's really no different than any other part. So to help remove the stigma, we want to be agents of that change. We want to just help normalize brain health is just health. And it's just another organ in your body. And sometimes it can benefit from medical treatment. Obviously, if you're living with someone, you're trying to help someone that's in crisis, that's a family member, your contact with the person is going to be extended. So you're not going to just like arrive somewhere, be there for 20 minutes and leave. You're going to have extended contact. So when you're speaking with someone and you've gone through these steps of listening, using a warm, meaningful, kind voice, personalizing the situation. You've been doing a lot of effective paraphrasing and mirroring. You're really making that really, really good connection with the person that's in crisis, that they're really being heard. The paraphrasing is making it really easy on me because I'm not having to try and stress myself out. How can I solve this problem that might have taken months and months, or it might be traumas that have occurred over years and years? How can I solve this in this, 30 seconds or 10 minutes or 30 minutes? I'm just paraphrasing instead. I'm using non-judgmental words. I'm not shifting the focus to myself. I'm trying to help remove the stigma the person might be feeling about being crazy or something like that. I've been working on that. Now I'm going to be with them an extended time because, they're a family member. Maybe we're a little more calmed down. We're going to move and sit somewhere that I know the person likes, maybe their favorite place out in the backyard, maybe their favorite spot in the house. Maybe we're going to go somewhere like the lake or something that I know that they like going to. I want to ask them. I want to identify the precipitating events, like literally what happened, like that led to this moment where you feel like you do. I want to know what happened. Then I want to help the person. So we identify the participating event. Then I want to help them focus. So a person doesn't arrive in crisis just like overnight or for one little incident. Normally it's many, many incidents, or a pattern of incidents, or a pattern of challenges, or various crises, or things that disrupt their normal pattern, their normal schedule, their normal way of thinking. So we want to help the person focus. What does the person want to change? So we want them to focus. Like what's the one thing that might be causing them like the most pain, the most sorrow, the most hopelessness? What's the one thing that's making them feel the most drained, or maybe disgusted or enraged, or any sad, angry, scared emotions. We want to try and get them to focus more on what's that main important thing. And then part of what we always want someone to do that's in crisis, because when you're in crisis, it's a very powerless feeling. It's kind of like not unlike other medical conditions. If you have a major injury, it's really a powerless feeling. You could just be laid up in a bed for weeks or months. It's a very, very powerless feeling. Well, a brain health crisis is really not any different. It's an injury you can't see. It can really put you in a manic feeling of like you're out of control. You don't know what's going on. Be a lot of frustration. So we want to explore resource and alternatives, but like we want to ask the person, like, make it theirs. What have you done in the past? So if your child's only 9 years old or really young, that might be a little more challenging because they don't have a whole lot of life history trying to deal with that problem. If they're a little bit older, if they're a teen, we want them to feel ownership. We want them to feel some power. We're not trying to solve this problem right away for them. We're kind of moving out of that role, and we want to explore some alternatives. Like, what have you done in the past that was helpful? Or what did we do as a family in the past? Or what did I do as your father in the past that was helpful? And we give that person, we give our child, we give them some feeling of power, of ownership, of, oh yeah, when this happened before, when I had a friend stop talking to me or whatever, I talked to my mom, or I talked to the teacher or somebody. They start thinking of something that, oh, this is the first time that I've had this difficulty or this challenge, and this is what I did before. And then we just want to help our child. We want to have the person in crisis come up with a plan of action. Like, what can they do? And so this is sticking with that pattern that we are not going to come in and like think, okay, I'm dad and I'm solving this situation. We're not going to do that. We want to have a plan of action of what can my child do? What can the person in crisis do? And see what they say. And that's giving them this feeling of ownership. It's giving this feeling of power. It's helping to replace the being hopeless. So it's identify the precipitating event, focus, explore resources and alternatives, and then we're going to come up with a plan of action. It's not one that I came up with on my own to solve. It's what can they do? And that's all kind of part of the behavioral change stairway that's really helps you, and it can really help you make this really, really almost startling for the person that's in crisis, the startling of the connectivity they get out of you speaking to them. It's really something that I found really, really effective. I try and share it with families all the time. I work with families all the time here at work at the police department. Our residents that we serve, that are in these challenges with their child, and they don't really know where to turn, and they're calling 911 for us to come out and for some help. And those are families that I work closely with, and this is part of the skill sets that I try and teach them that can be really effective. It is really effective in helping to influence a behavioral change and show the person that's in crisis that, you really, really care. Like, you're not just this authoritarian force. You're someone that really, really cares, and you really want connectivity with them. That's basically it. I'd be really curious. I mean, there's a lot more we can talk about, but I guess, Kevin, I'd be curious if we have any questions, or I don't want to just ramble on and have the audience be like, when's this guy ever going to stop talking?
No, that was really, really, really great insight. I'd like to kick off with a question, and then we may have a few others. We've heard so much this year about the pandemic and how that's changed so many things. I'd be curious, from your perspective, in your job every day, how's it been different in 2020 since the pandemic? What are you seeing, out there, and is it different? And if so, how?
It's very, very different. It's statistically very different on the volume of brain health related calls involving juveniles. It's statistically much, much higher for the hospitals that I partner with. So behavioral health hospitals that I partner with, their rates of being at capacity day after day after day after day, that when they only service juveniles, are off the charts compared to just, say, this time last year. The change in the routine for these young people and the isolation factor of it, it's hard to put it into words. It's definitely significant. It's definitely something that when I'm speaking with parents that I'm working with, I'm not trying to be an alarmist. I'm not trying to overstate it or create a bunch of fear, but it's definitely something that I want to communicate with the families that I'm working with the fathers and the mothers, that it is definitely a significant thing. And it's one of those things that about not shifting the focus to ourselves, because I might think, oh, just having to do school from home and look at everything on a video screen, that's not a real big deal. But for a young person, that might be the most troubling, troubling, challenging thing they've ever experienced. I mean, it might be the biggest thing that's ever happened to them. So then for me to have a reference point for how I might feel, I want to think of what's the biggest troubling thing that's ever happened in my life to kind of frame it for me. But like I said, I'm not trying to be an alarmist, but we have definitely seen it is a big, big impact. It's very, very challenging on our young people.
Hey, if anybody else has questions, feel free to unmute and jump right in.
Hey, Todd, this is David. Can you hear me?
Yeah, great. I can hear you great, Dave.
Oh, good. Yeah, so we have a kiddo who has some significant behavioral challenges, and what I notice is that there are trigger events that just take him into like a rage kind of sequence. And what we've been told before is to try to increase the window of tolerance, because he goes from 0 to 60 on a dime. Have you seen any techniques working with families just to help kiddos not immediately flip when? And typically the trigger is just saying no. Like if we say no in some way, even if we try to say no in a nice way, he gets triggered and then he just rages. So I didn't know if you have seen any techniques that help sort of manage those triggers and allow them to process their emotions. He has trouble just controlling his impulses, and so we're trying to increase that tolerance, just like we do. And when we hear bad news or we hear something we don't like, we process it, we think about it, we don't act out. But he tends to go first to the acting out. So I didn't know if you had any success with kiddos that are just triggered very easily, and any suggestions around that.
So One of the things, David, that I would recommend that you do, and I've worked with some families that have spoke to me about similar situations, is, and maybe you're already doing it, is you want to try and keep some kind of either if you use it on a note thing on your phone or a device or old school 1980 style in a notebook, you want to keep track of what those triggers are. And then we also want to keep track of what are the hooks. So we call it hooks in negotiation. Hooks are like what's good. So I'd want to, so like if I had my team and we were working with your son, we'd want to look at through experience with him, what is the thing that triggers him? What's that behavior? What's that word? And then we want to try and look at when we speak with them, what we use, what helps to get back to what's normal, whatever the normal level is. And then I'd want to write that down, and I'd want to start trying to focus on those things. It's a process because, of course, you won't have a team of 8 people with you, and you won't have someone running the intel, and you won't have a scribe, and you won't have all that other stuff. But that's like a starting point to figure out what that is. Because then, if the word no is going to result in that escalation, I'm simply not going to use that word anymore. I'm going to have to figure out something else that gets the same effect as no, but doesn't have that trigger with your child. Because if that's what's going to happen with that word, then I'm going to stay away from that. And that's one of the things I try and work with families that are in similar situations is obviously us just being in charge is not working because we're trying to deal with a medical condition. And so then I've got to start trying to modify what my response is to get a different outcome. I can't just expect, I'm going to say no for 10 times or whatever, and then finally, get through because it's probably not a rational situation because we're dealing with a medical condition. So that's one of my first pieces of advice is if you're not already doing that, start doing that. So that'll be something that you have concrete, even if it's just notes on your phone. And if you're working with your wife or somebody else, you'll be able to have that as a reference. And you'll start gauging like what's successful because you're looking for like the hook. You're looking for what's actually successful. And sometimes it might be a constant moving target. So you might get off a no and get to something else like, hey, we need to consider something else, something you replace no with. And it may work for a while and then it may start becoming a trigger and then we're going to have to modify again. It's something that we have to think in our head. We're not thinking concrete. This isn't just a rational discussion because it's a medical condition, and we're going to have to be ready to modify our techniques to keep trying to, get that behavioral change that we're looking for. And the main way to do that is we've got to make some kind of, get some kind of influence by word choice. Sometimes can just be it, but we have to be willing to be really flexible, not be stuck on I just said no or that's the word we're going to use. And stay with it. We want to be really flexible. That's why I try and talk about the families that we have to be really flexible and ready to modify what our tactic is. I've used the word tactic, but what we're going to say or do to try and get the good behavioral change. That's just one idea. It's obviously that it's very complex.
Thank you.
Todd, we had a question come through the chat from Dr. Ed Nace. The question is, how do you decide when to transport someone to a mental health facility, and how do you decide which facility?
So that deciding to transport is just dictated by the state law for emergency detentions. They call them apprehensions by a peace officer without a warrant. So when the officers would get dispatched, to the residence or the location where the patient is, they hear the information from the reporting parties, be it family or coworkers or roommates or whatever. They try and talk to the actual patient themselves, but then transporting is just dictated. Does it meet the state law? Is the criteria there, which it's basically to meet the state law without reading the boring state law to you. It's mainly is the person suicidal or homicidal right then? Like, are they going to do that kind of harm to themselves or other people that they're there with? So the transport's decided by state law, and then state law also decides on the facility. State law dictates that it's going to be the geographically closest to the location where the detention would be, geographically closest facility that has the services. So ideally a behavioral health hospital. If you're in a metroplex like this, If you're just way rural, there may not be a behavioral health hospital. So the geographically closest appropriate facility might just be a regular ER. But both of those are dictated by state law. Complications arise in that when, so obviously, well, maybe not obvious to all our participants, but we have very limited resources in North Texas. So say we have a juvenile that meets the state law criteria for an emergency detention, and we want to transport to the geographically closest facility that is licensed to provide crisis stabilization for a juvenile. Well, they might be at capacity. They might not have an open bed. There may not be an open bed at that facility. So to assist the patient and that facility, we might have to divert to the next closest facility. But both of those are basically decided by state law and then occupancy. And like I said, we have limited resources for behavioral health hospitals. We have a limited number of bed space. So then we could run into driving to a farther away facility than the closest geographic one due to that situation, being at capacity. That is something, that's a really good question. And that is something that a lot of professionals like myself and the Garland Police Department, we are looking for solutions where we don't have to be doing that. We want to try and like this forum here is a great example. We want to communicate with great institutions like the Halliburton Foundation and their members, and we want to be looking at solutions, or we want to be looking at improvements that come before needing an emergency detention. Like emergency detention is like we want it to be the last thing we need to do when other attempts haven't produced the results we were looking for. We really want it to be a last resort, especially, I mean, we want people to get medical treatment on much more on their terms rather than something that's forced on you. That's a great question.
Hey, Todd, this is Jeff Becker. Your talk has been amazing this morning. I really appreciate it. I've learned a ton, taken lots of great notes. Following up on that last question, if the patient is a minor and they were not with their family and the decision is made to take them to a facility, what's the protocol on notifying the family?
So at the Garland Police Department, and I would assume you'd think at any professional place, they'd want to do the same, but the Garland Police Department, we're simply going to get a hold of the parents, like no matter what. We're going to do everything possible, from trying to call them to drive to send an officer to their place of work or something. We're going to do everything possible to inform the parents. And any quality behavioral health hospital that's licensed to treat juveniles, once the transport arrives at the hospital, that's going to be one of their number one concerns. Have the parents been notified? And they're not going to want the law enforcement to go anywhere until we know that parents have been notified. So really, that's the main thing is if you're a parent and your child's at a school, or your child goes to some after-school program, or if they go to some kind of daycare, it's really important that your updated contact information is there with that institution, because sometimes we run into some challenges where if the emergency detention occurred at the school and then the records are outdated and we've got a phone number that doesn't work anymore, and that's when we start trying to figure out, well, where do they work? Where's their house? We're going to have to send another unit over there to notify the parents. Because obviously that's unbelievably important. You don't want your child going to get medical treatment without the parents' knowledge.
Yeah, and I appreciate that. Unfortunately, when you meet with your colleagues in other departments, just a quick little story.
Yeah.
So minor was taken to Parkland by the Dallas Police Department at 3 a.m.
Wow.
And my understanding was that the Dallas police then wave their hands and it's up to Parkland to notify the parents.
Yeah.
But Parkland doesn't want to notify the parents until they've made their initial assessment that if it happens at 3 a.m., parents
Right.
don't get notified until a few hours later.
Okay.
And it just seemed, I was surprised that the Dallas Police Department would not do exactly what you said, which is, hey, let's try to go notify the parents. So I don't know if that was different in Dallas or not.
Now that probably, I mean, they have 3,500 officers. That might have been isolated to just whoever those officers were that affected that emergency detention. I mean, but we've got to do better than that. I mean, that's something that obviously have to do better. That's something that, I wouldn't have any problem. I think it's something to bring attention to that with the Dallas Police Department. That's something that needs to be addressed. If that happened at the Garland Police Department, I would want to know about it, because I'm going to follow up with those officers, and we're going to get that rectified where that doesn't happen again. Because that's definitely not what we want to have happen. And I think, like, as an officer, if you think of it, even if you don't have children, if you think of it, how would I want to be treated? That's not how, you'd want to be treated if your child was going to get medical treatment and you weren't being notified about it. So that's definitely not an example of doing what we all should strive to do, is perform at a much higher level than that.
Thank you. Do you know who at the Dallas Police Department I would try to contact about that?
Kevin has my contact information and stuff. I'd love to talk to you some more, or shoot me an email. I have contacts with all the area police departments. Most of them are all part of Lima. So yeah, I can definitely put you in touch with several people at the DPD that can help you out with that.
Thank you, Todd.
Things like that are definitely not upsetting to me, and it shouldn't be upsetting to any other professional. We want input like that from Jeff, like from you. We want information like that because we want to perform at a higher level. I mean, anyone I know in law enforcement, we want input, good and bad, or good and constructive, and we want that kind of information because we want to keep doing better. We want to keep getting better and perform at a higher level. So if something like that happens here at the Garland Police Department, we want to know about it, because we're going to do something about that. We're going to work on that and reduce the likelihood that that's ever going to happen again. Some of it, and this is not an excuse, but some of it for the officers is they're so far out of their skill set when they go to calls like that. Like, they are. Sometimes I wonder, like, I use analogies, and I wonder if it's kind of like asking if I would have asked my family doctor to do the surgery on a disc in my low back, and he'd been kind of like, "What?" Got me out of my skill set. So for some of the officers, John, I'm definitely not making excuses, because we want to perform at a high level, but some of it's just they're so far out of their skill set when they're encountering a call for service like that. It makes it a little more challenging on them, but we can definitely do better.
And Jeff, I will connect you and Todd right after the call via email. And then I also noticed Mandrell Drakes from Dallas City Hall provided on the chat box. He's provided his email contact information. So Mandrell, I'm assuming you did that as another point of contact. Is that right?
It's really quickly. I'm with the Dallas Police Department Community Affairs Unit.
Oh,
if you hear anything in the background, it's my daughter. I'm on daddy duty right now. But if you can send me an email, Jeff, I can clear that up for you, get with my supervisor, and we can tell you what the actual protocol is. I do know we have a right care team, and you know about that, Todd. And it's not in every division because it takes money to get those resources, but we are working on getting that in every division. The right care team basically is a team of a social worker, an officer, psychologist, about a 4 or 5 man team that goes out and deals specifically with these types of calls for service. So I can get you all that information. Just send me an email, and I'll get with my supervisor, and we can take care of that.
Thank you, Mandrell. I appreciate it.
yeah. Hey, Mandrell, thank you for joining us. We're glad to have you this morning.
Absolutely.
Yeah, the right care team is just awesome. That's they've kind of patterned that after other successful programs that are in Oregon and Colorado. It's an awesome resource. And Jeff, that was one of my contacts that I was going to send you. Is that's a case the right care team would want to know about. And that's like training they can bring to patrol, to lineup training. That's information that they could bring. Hey, this is what occurred. This is not what we want to have happen. This is not ideal. This is not putting the patient and their family first. We want to put the patient first. It's a medical condition. We want to put them first. But that's who I was going to put you in contact with too. Is the right care team that's an awesome asset there in Dallas, and they're going to expand that team. The city manager is going to expand it. They're going to add, like, they have one team now. They're going to add like 4 or 5 over the next 2 years. It's really exciting. Yeah.
Thank you. I just want to let everyone, the Dallas Police saved the kid's life. So, I mean, they were heroes. I'm not putting any blame on them. And, but I will follow up. Thank you, guys.
No, yeah, I mean, I think, Jeff, I think that is great to hear. And like, I don't really ever, I think Mandrell can probably attest to this too. I don't ever think about things like these as blame or anything. I'm thinking about, hey, these are the citizens, these are the residents we're serving. This was their experience. And if there's something there for us to improve, that's what a professional police department does. That's what any professional organization does. We want to improve. We always want to be improving. So feedback like that's really important. I don't think we should take it as like a negative attack or anything. It's just how we're trying to get better. We want to evolve, especially when we're working with someone that's a patient. We want to do the best we can for the patients and the residents.
Absolutely. Feedback is necessary and is wanted. So anytime you give any feedback like that, I take it back to my supervisor and we make sure everything is going the way it's supposed to go.
Well, guys, we are coming up very quickly on 9 o'clock. And so we're going to wrap this up. We've just posted on the chat box for 2021, the dates of our Dad2Dad. Well, starting in March is Tuesday, March 2nd. Then we're back on Tuesday, June 1st, Tuesday, September 14th, and Tuesday, December 7th. So hopefully y'all will put that in your calendar for 2021. And you can always go to groundhalliburton.org if you want to learn more about Dad2Dad or any of our other programs. And with that, I wish everybody the happiest of holidays and better days ahead. So thank you so much, everybody, for joining us this morning. And thank you, Todd, for being a great speaker for us this morning. We really appreciate you.
And I appreciate the opportunity. And Kevin has my contact information. I'm also on the City of Garland's website. You can find me on there. Anytime I can assist you or your family, please reach out. I mean, we are the agents of change here. We're who moving this forward. Let's keep working together, and we'll do some good things. But I really appreciate the opportunity.